Now see, I have done the right side. Now I've come to the left side. Again, huge amount of lymphoid tissue is still pending. This is the eustachian tube. You can see tubal tonsils here. Again, I'll start from the superior pole, the superior boundary of the adenoids again. Saline, please. Oh no, increase the saline flow. All right. So let me debulk. That's the superior boundary of the adenoid, periosteum below the sphenoid bone. You're not supposed to open up the periosteum. You're only supposed to reach the periosteum and define it. Now that was the passavant sewage there. I'm just defining the areas. Now I'm debulking saline. All right, so that you don't have to take your scope in and out. All right, so layer by layer, remove all the tissues. Saline, wash. Thank you. Now, see, this is the eustachian tube. This is the torus tuberous, and there's a lot of lymphoid tissue on the torus tuberous. So I'll remain 2 to 5 millimeter away from the eustachian tube orifice and submucosally remove all the lymphoid tissues from the torus tuberous because I want the fluid in the ear to get dissolved without any Grome insertion. And this is the best you can do because misery of a child after Grome, we all know. Now I am going till the muscle but not opening up the muscle, only removing the lymphoid tissues over it. That's the lateral boundary in the anterior part. And now that's the fossa of Rosenmuller, which is the lateral boundary in the posterior part. You can see all the lymphoid tissues. And yes, I am treating it like a local malignancy. What is the harm in doing it? Let's at least treat it like a benign tumor. Remove it completely. If you can do it safely, there is no harm because it's somebody's child undergoing a surgery. He should not undergo a surgery again. And if he's undergoing a surgery, he should have the best chance to benefit from this surgery completely. Fine. If it is not possible because the science has not advanced, then nobody can do anything about it. If it is my own expertise, then I think I should be getting the best expertise or referring the child to the one who can do the best. Saline, please. That's the buccopharyngeal fascia. That's the periosteum below the sphenoid bone. Right? Fascia is not open, only defined. And we have a little tissue on the lateral aspect. Be careful not to open up the vessels. So in a country like India where there are 150 crore people, obviously not even 10 crore can afford this technology. I totally agree with that. For rest of the 130 crore, obviously we have to have alternatives. I'm not saying this is the only way. This is one of the ways. And if you ask that rest everything remains common, the only additional cost is 11,000 rupees or 10,000 rupees for the wand. It's duty to ask whether the parents can afford or not. Even mm, my assumption is that at least 50% of this country's population will say yes to a 10,000 rupees addition if it can give this kind of confirmation that the child will not require another surgery again and it will be a painless, bloodless, and recurrence free procedure. And this is our baby. This research is from India. This research, I understand that the acceptability in our country has some issues because the research is from here and it's not from the West. If this research was from the West, then everybody would have accepted it so easily. But no worries, it's 9 years, another some few more years, and it is already accepted by all our Western colleagues. The problem is only in our own country. Thank you for watching.